Welcome back. You're watching MSNBC. I'm Stephanie Ruhle. Joining me now, Democratic Senator from California and former presidential candidate Kamala Harris. Senator, thank you so much for joining me. I know how busy things are, and being a sitting senator, what an extraordinary week this has been. Help us understand this $2 trillion package. The vote was 96-0. The American people don't get to see bipartisanship that often, and this one's a biggie.
It was, and I think it spoke to the moment, which is that this is a moment of crisis and it required urgent action. I think every member of the Senate, certainly those that I work with on a daily basis, will tell you this was not what we wanted. It is not enough, but it is meeting the moment in the best way that we could with a sense of urgency. Our priorities, of course, and I can't praise Senator Schumer enough for the work that he did on it. Our priorities have been about workers. Our priorities have been about hospitals. Our priorities have been about small businesses. And thankfully, there is some relief for each in this bill, but it is definitely not enough. Many of us were fighting, for example, and I've been fighting for what we need to do around paid sick leave. That's not in the bill. Extending the benefits in terms of SNAP benefits for families that need to feed their children, that's not in the bill. There's work we need to do recognizing that people who've been laid off and fired are going to lose their health coverage, and what we need to do for the uninsured. So there's still a lot of work to do.
So if there's a lot of work to do, just getting through this $2 trillion is a lot. When are you going back to the drawing board for phase 2?
Well, I'm here in D.C., and I think many of us are committed to continuing the work. We have certainly, over the course of this last week, been talking about what was passed this morning or late last night in the context of what we need to do next. And so the work will continue, and there's certainly a lot of work to be done. You've been reporting 3.3 million Americans just this week have applied for uninsurance benefits, or unemployment insurance. We have in California, the governor announced 1 million Californians just over the course of the last week and a half that have applied for unemployment insurance. So the crisis continues. I think all medical and public health professionals have told us we have not yet peaked. The crisis continues. People are continuing to be laid off. Small businesses are going out of business. The crisis continues. And I think the leaders in Washington, D.C. know, or should know, that it is this moment that requires us to lead and be present to do that.
Well, let's talk about your home state of California, because there are reports that nurses are taking drastic measures protecting themselves because of the shortage of personal protective equipment. Help me understand this, because state lawmakers have said we need the federal government to assist. But then there's other private businesses who are saying we're trying to offer things. There's a backlog. Lawmakers aren't getting back to us. Where's the jam?
Well, there are a number of issues here, right? There's the issue of what the president, if you want to start at the top, what the president could do to unlock his powers to require production and domestic production of the medical equipment that is needed to help public health professionals do their job, and to also help these public health professionals not be sick and save their lives. And so masks at the top of the list, ventilators, of course. So there is that at the top of the list. There's the work that we did through this bill that will allow and bring $150 billion to states and to hospitals in particular to help them do the work of paying for and bringing in the supplies that they need. But then the production piece is a very big part of that. If the supply is not there, no matter how much resources you have to buy it, if there's nothing to buy, then it's not going to fill the need. And that brings up the need and the importance of the private sector. In California, for example, we have Tim Cook at Apple, Elon Musk, and the others who have said that they're going to help with production and what they have in terms of any supply that they have. This is a moment of crisis that is requiring and highlighting the importance of public-private partnerships. And I know the governor in California is working closely with the private sector to maximize that capacity.
Then help me understand this. This is the call I keep getting from my mother. Tim Cook's generosity, Elon Musk's generosity are a positive. What is the rationale behind the president not enacting this, which would force production? Wouldn't we want to help our heroes putting themselves in harm's way? Can you help us? I realize you're not the president, but can you help us understand that rationale?
I tried to be.
My mother's watching. My mother's watching.
Yeah, I mean, is she Mrs. Ruhle? What's her name?
Louise!
Stephanie's mom, Louise. I've been asking the
Louise
same
is
question,
watching.
Louise.
She wants to know.
Louise,
Yes.
Louise, I've been asking the same question, and I don't understand it. And when confronted with it, he tells our minority leader, Chuck Schumer, on a telephone, hey, activate it. And then the next day he's saying, I'm not Venezuela. I'm not going to take over as a socialist government. And I don't think he gets it. I just don't think he gets it. And perhaps this is one of those other moments where he doesn't fully understand the role, responsibility, and power of the President of the United States to do good for the people. This is a national crisis. Let's be very clear. The government has 3 essential functions, and one of them is public health. This is that moment that we have seen then elected leaders in local government and state government rise to this moment. Mayors around the country, governors around the country rising to this moment. But unfortunately, we have someone in the White House who I don't think understands the core and essential functions of government. I don't think he respects those core and essential functions of government to understand what he should be unlocking, and in this case, to require domestic and to encourage and incentivize domestic production of the health resources like masks and ventilators that will save American lives. I don't understand, Louise. I don't understand it. I don't get it. I think it's an abject failure of leadership.
Senator, I'm going to speak on my mother's behalf because I assure you she is calling me right now saying, see, when the women are in charge, they know all the answers. Senator, thank you so much. I really appreciate it.
Take care.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.